Back to that story now we tried bringing you at the top of the hour. There is still no deal between Northern Light Health and Anthem Blue Cross-Blue Shield. It is expiring at the end of September.
Yeah, without a new deal, thousands of Mainers could be affected. CBS 13's Asia Reed joining us now live in studio. And Asia, where do these negotiations stand right now?
Good evening, Greg and Marissa. I spoke with both Northern Light Health and Anthem Blue Cross-Blue Shield leaders today, and they tell me that they hope to make a deal as soon as possible. But if they don't, Northern Light says its facilities will be considered out of network for anyone with Anthem's insurance, and that means higher out-of-pocket costs for patients.
Our focus is on sustainability of healthcare in Maine, and so
Northern Light Health and Anthem Blue Cross-Blue Shield at odds, both claiming the other one is the one stalling progress in coming up with a new deal. Northern Light's Chief Financial Officer James Rohrbaugh says Anthem is increasing premiums on customers, while at the same time barely increasing the reimbursements paid to the hospitals. Anthem Maine President Denise McDonough says that's not true. She says the current contract includes reimbursement increases that are at or above inflation. Instead, McDonough claims Northern Light has failed to meet an expected level of quality care.
In other words, there's a component of their compensation that is quality based. So in order to earn all of it, they have to meet those metrics.
achieved about 85% of that incentive, which with an insurance contract actually is really good.
Rohrbaugh says Anthem frequently denies payments for medically necessary care. Anthem says Northern Light is looking to increase costs to patients by 30% over 3 years.
In fact, if we were to agree to their demands, it would increase costs in Maine by over $218 million for our customers and patients.
McDonough says it would also make Northern Light the most expensive hospital in Maine. Anthem wants to see current expenses stay where they are, which they say are in line with other healthcare systems, including Maine Health.
This is a replay of a very similar situation between Anthem and Maine Health about 3 years ago.
Back then, Maine Health threatened to withdraw its largest hospital from Anthem's network over what it claimed were millions in unpaid expenses. Maine All Care's board chair, Dr. Julie Pease, says it's time to rethink how healthcare operates.
It's going to be Maine patients that suffer.
Northern Light says that out-of-pocket costs at the hospital would not change until January 1st, and no immediate action is required from patients. Live in studio, Asia Reed, back to you.
Asia, thank you.